Can type 2 diabetes be reversed? Swati Gorai, consultant endocrinology at Jupiter Hospital, Pune, explains how remission works, who can benefit, and why diet, exercise, stress, and sleep management are key to long-term diabetes control. One of the most common questions patients ask is, can diabetes be reversed? For decades, type 2 diabetes was considered a lifelong, progressive condition. But new research and real-world cases are giving hope that remission is possible. Type 2 diabetes develops when the body becomes resistant to insulin or the pancreas cannot produce enough insulin to regulate blood sugar. While traditionally seen as permanent, studies now show that with the right lifestyle changes, many people can return their blood sugar to a non-diabetic range, sometimes without medication. Also read type 1 diabetes in children. 10 early signs you shouldn't ignore. Reversal, often called remission, does not mean diabetes has vanished forever. The risk of high blood sugar remains, and if healthy habits are not maintained, diabetes can return. Think of remission as a state of control, often achieved through weight management, diet, exercise, and sometimes medical interventions like bariatric surgery. The foundation of diabetes reversal is weight reduction and lifestyle change. Research suggests that losing just 1,015 of body weight can restore insulin sensitivity and support pancreatic recovery. For some, weight loss medications or bariatric surgery may be options, especially when lifestyle changes alone are not enough. These decisions are personalized, based on individual health goals. Remission is more likely in people those with long-standing diabetes or significant pancreatic burnout may not achieve full reversal, but they can still see better control, fewer medicines, and reduced complications. I always emphasize empowerment, not fear, says Dr. Swati Gorai. Diabetes doesn't have to feel like a life sentence. With consistent choices, patients often find they need fewer medicines, have more energy, and lower their risk of long-term complications. Yes, type 2 diabetes can be reversed in many people, but only with sustained lifestyle changes and medical guidance. It's not about quick fixes or miracle cures, but about building habits that last a lifetime. As Dr. Gorai reminds patients, you hold the power to change the course of your diabetes. Small, consistent steps add up to big, lasting results. Disclaimer: tips and suggestions mentioned in the article are for general information purposes only and should not be construed as professional medical advice. Always consult your doctor or a dietitian before starting any fitness program or making any changes to your diet. Also read diabetes types, symptoms, causes, tests, treatment and prevention. Disclaimer: tips and suggestions mentioned in the article are for general information purposes only and should not be construed as professional medical advice. Always consult your doctor or a dietitian before starting any fitness program or making any change.